Hello, my name is LaDonna, and today I'll be going over May-Thurner Syndrome. Most people may not have heard of this before because it's not very common, and most people that do have it, they don't realize they do until they start having symptoms or start getting tests run that are able to visualize. It's caused when the left iliac vein is compressed by the right iliac artery. So when they cross in the pelvis, that right iliac artery is keeping pressure on that left iliac vein, and it's causing blood to not flow through freely. And of course, that can increase the risk of DVT in the left lower extremity because that blood's just sitting there, doesn't have nowhere to go, and it's going to cause a clot. Other names for May-Thurner syndrome are iliac vein compression syndrome and Cockett syndrome. And MTS is random, not genetic, so you can't inherit it from your family. It's just kind of you get it or you don't. And here is a picture of the compressed iliac vein with power Doppler, and then you can also see it in color Doppler. Risk factors and symptoms. You're most likely to get May-Thurner syndrome if you're a female, you have scoliosis, you just gave birth, or you've had more than one child, you take oral birth control, or are dehydrated. This usually occurs between the ages of 20 to 40 is where it's most common at. Most people do not realize they have May-Thurner syndrome until they present with a DVT. So, like I said before, they don't have any symptoms. They're not going to know they really have it until they have tests run. Symptoms include swelling, pain or tenderness in the leg, redness or discoloration of the skin, enlargement of veins in legs, and back and pelvic pain. Other symptoms that can occur are burning, itching, numbness, tingling, heaviness, aching, throbbing, and venous claudication. Some of these symptoms are similar to a DVT because that will eventually what it will lead to is a DVT. When these symptoms occur, they are the result of elevated venous pressure inside the leg. So that pressure is getting elevated because that blood's just sitting there, it's not moving, so it's causing build up in that vein. Exams and appearances. Sonographers play a crucial role in ensuring a patient with May-Thurner syndrome is diagnosed accurately. Lab tests for May-Thurner syndrome include CT or MRI, ultrasound, a venogram, which is a type of x-ray that uses dye to show veins in your legs, patient history of DVT recurrent, unexplained LLE edema, venous claudication or varicosity should create suspicion of MTS as they cause. With MTS, the right iliac artery squeezes the left iliac vein when they cross each other in your pelvis, like I said before. With that pressure, blood flow cannot freely flow through the left iliac vein, causing some blood to swirl around and create clots. Pressure buildup from resistance and obstruction at the level of left common iliac vein will worsen as condition progresses. This can lead to valve failure over time because if that pressure is just constantly there, it's not allowing those valves to move like they're supposed to because there's pressure, it's not being able to move. And so that can cause venous reflux eventually. The stages of formation, which I got off of ARDMS. One is iliac vein compression without structural vein changes. 2 is venous spur formations, which restrict blood flow and increase the risk for edema and DVT. And 3 is obstruction that causes DVT, edema, and formation of varicose veins. And then May-Thurner syndrome can be acute or chronic. Acute is onset of left leg edema, usually easier to diagnose. Chronic is more difficult to identify and requires comprehensive investigation. Visualization of greater than 50% stenosis and diameter of vein is considered an indicator of left common iliac vein compression related to MTS. Because with the compression, your diameter isn't going to be as big as it usually should, so that can create stenosis. Secondary indicator of MTS is venous collaterals, intraluminal spurs, changes in hemodynamic flow that's greater than 2 millimeters of mercury across the stenotic region of the patient in supine position. And here's an ultrasound image showing reflux of the common femoral vein. Well, the right common femoral vein does not have reflux, but the left common femoral vein is the one that has the severe reflux due to venous pressure change of the left common iliac vein by the right common iliac artery. You can also, here's a good visual of it that's not an ultrasound image. You can see where that compressed, where it's showing compression, it's making that iliac vein bigger, and it can cause more clots or DVT. Treatments: May-Thurner Syndrome should only be treated when symptomatic. If patients aren't having symptoms, usually it's not going to be that severe, or it's not bothering them enough that they should treat it. Goal of treatment is to reduce symptoms and complications. Medications typically diminish the tendency for your blood to form clots, because that's what it will eventually turn into if you don't get it treated for. Angioplasty and stent are common treatment. They use a small balloon to expand the left iliac vein and put a stent to keep the vein open wide enough for blood to flow through. More severe cases, you can do a bypass surgery or surgery to move right iliac artery, and that's probably if they're having major symptoms where it's just constantly bothering them, and they may do some more severe treatment with it. And that is it. And my M fell off, sorry. Thank you.